Moving on to the next topic is anesthesia. Sir, welcome. Chali. Anesthesia is what, sir? Your loss of sensation is anesthesia. Now there is an excitatory neurotransmitter and inhibitory. Who is excitatory? Glutamate. So we are dividing this anesthesia into three forms. What is regional, general, and your local anesthesia? Regional is further divided into two. One is epidural and one is spinal anesthesia. They do not cross the blood-brain barrier. That is why no sedation is there. No sedation is there. General anesthesia, yes, they have some IV, they have some inhalational agents. Yes, they can cross the blood-brain barrier, sir, and yes, they can cause the sedation. They can cause the sedation. They can cause the sedation, sir. Done, sir? Now, sir, regional anesthesia, or you can say central neuraxial block, regional anesthesia, they cannot cross blood-brain barrier, no loss of consciousness, and we are having spinal and epidural. Two types are there, sir. Spinal and epidural. So, my dear friends, in the spinal, what structures we are piercing and we are going till what space? So remember, after skin, you have to remember 𝗲𝗲𝗹𝗲. Now S for skin, S for subcutaneous fascia, S for supraspinatus ligament, L for ligamentum flavum, D for dura mater, A for arachnoid matter. After arachnoid piercing, you are reaching a space called as subarachnoid space. Subarachnoid space. You are reaching to a space called as subarachnoid space. Subarachnoid space, sir. Clear okay, funda? So you are right starting, and the last structure what you are piercing is a arachnoid matter. Then you are reaching the subarachnoid. And in the adult site is L3, L4. In children, it is slightly lower because in children, the spinal cord is little bit on the lower side. That is why in the children, we pierce from the lower side, that is L4, L5. In the adult, it is L3, L4, L3, L4. Now, sir, pierce till, your answer is subarachnoid. Pierce till, your answer is subarachnoid space. तक tear करना है और उससे पहले किसको tear करना है? Arachnoid matter को. Now, indication, any surgery below the level of umbilicus. This indication is same for the epidural also, sir. This indication is same for the epidural also, sir. The needle which we use right here, sir, 𝗲𝗍𝗃, 𝗏𝗃, and 𝗲𝗲𝗃. 𝗲𝗃 needle is dura cutting needle, 𝗏𝗃 is for dura splitting needle, and another which is oval shaped head you are seeing right here is a 𝗲𝗲𝗃 needle. It is a 𝗲𝗲𝗃 needle, sir. Sir, 𝗲𝗃 is a dura cutting, 𝗏𝗃 is a dura splitting, and 𝗲𝗲𝗃 is a this oval shaped needle you are seeing right here, sir. Now coming on to the epidural anesthesia. This is again a catheter based technique. इसमें catheter डाल दिया जाता है और drugs दिए जाते हैं. My dear friends, the site is thoracic and lumbar vertebra. You have to pierce take ligamentum flavum. Ligamentum flavum, that is SIL only. Skin, subcutaneous fascia, then SIL. L for infraspinatus, then ligamentum flavum. After ligamentum flavum, you are going to enter a space called as epidural space. Epidural space. Epidural space, sir. Indication is same as spinal anesthesia, that is any surgery below the level of umbilicus. And here the needle used right here is a 𝗲𝗲𝗃 needle. Here the needle used is going to be what, sir? Your 𝗲𝗃 needle. 𝗲𝗃 needle. Now complication of regional anesthesia: hypotension, bradycardia, respiratory distress, urinary retention. Systemic toxicity can only be seen with the epidural. Why? This systemic toxicity can only be seen with the epidural because epidural, you are not entering directly into subarachnoid space. So where you have to inject more drug. The more the drug you are giving, the more systemic toxicity will be there, sir. What are the absolute contraindication? Increased ICP, infection, hypovolemic shock, patient nahi lagana chahta, cardiac disease, coagulation disorders. So these are some complications. Okay? Chalo. Now general anesthesia can cross blood-brain barrier. No loss of consciousness, yes, present. Now what are the components of the general anesthesia? Pehla component is loss of consciousness, because the person should be unconscious. Then there should be a loss of reflex. Then no memory. Muscle should relax and there should be no pain. These are the 5 important components. Yes, what are those? First is loss of consciousness, loss of reflex, amnesia, no memory, the muscle should relax, and analgesia, no pain also should be there. Steps of general anesthesia. How general anesthesia there? ठीक है? How general anesthesia is there, sir? 3 to 5 minutes पहले ऑक्सीजन देना है, फिर induction and maintenance you have to choose. Induction is by IV or inhalational agent, and maintenance is by continuing the general anesthesia. Continuing the general anesthesia. Continue the general anesthesia, sir. Now, reversal agent. How we will reverse it? Either we will stop giving, half-life will go, and the patient will be in the. If we want the reversal, if it is not happening that way, we have to give the agents like 𝗲𝗵, which is GABA antagonist. GABA क्या करता था? सुलाता था, inhibitory. अब inhibit को रोकने वाला एक agent चाहिए, that is your 𝗲𝗵, the GABA inhibitors. Also, we can use 𝗲𝗵, 𝗲𝗵 for the neuromuscular inhibitor reversal. जो muscle relaxant हमने दिए हैं उसके लिए 𝗲𝗵 होता है, MEDI नहीं होता, ठीक है? Now, local anesthetic. Loss of sensation is from particular area. For example, lignocaine, है ना? lignocaine की जेली लगाते हैं, ठीक है? चलो, और उसके बाद remember this lignocaine का mechanism is sodium channel blocker. Sodium channel blocker, ठीक है? उसके बाद inhalational agents की बात करेंगे सर. Halothane, isoflurane, 𝗲𝗲𝗹𝗵𝗺, des, enflurane and methoxyflurane. Out of them, methoxyflurane is most potent but never used because of nephrotoxicity. They all release fluoride. They cause arrhythmia, kidney damage, hepatotoxicity. More or less, that is something different, sir. More or less, that is something different, sir. ठीक है? चलिए, उसके बाद आ जाइए सर. Minimum alveolar concentration. So, how to remember this minimum alveolar concentration, my dear friends? Remember, this MAC is inversely proportional to potency. ज़्यादा MAC, more the MAC, less is going to be potency. More the MAC is and less is going to be the potency, my dear friends. Less is going to be the potency, my dear friends. And how to remember? HISD, HISD, then xenon, nitrous oxide, छोड़ो. HISD is important. Now, H for halothane, H for hello. Hello bolna is important to remember. Most potent is halothane. If halothane is most potent, so halothane's potency is going to be the less. Okay? If halothane is most potent, the halothane ka MAC is going to be less. MAC is going to be minimum. So same way it will go to left to right side. Okay? Chalo. Now, sir, blood gas solubility. Blood gas solubility. Blood gas solubility. Now, blood gas solubility is inversely proportional to the speed. जितना ज़्यादा blood gas के साथ मिलेगी उतनी कम speed हो जाएगी. So here the mnemonic is DSIH. D for दौड़ा दौड़ा. तो दौड़ा दौड़ा मतलब डेसफ्लोरेन की स्पीड सबसे ज़्यादा है, फिर सीवो, आइसो, फिर हेलोथेन. तो अगर स्पीड सबसे ज़्यादा है तो ब्लड गैस सॉल्युबिलिटी सबसे कम किसकी होगी? डेसफ्लोरेन की होगी. This is how you have to remember. DSIH, not DISH. Halothane. Now let's talk about the gases one by one. Halothane. So this is the second best used in the children. Halothane is a second best used in the children and stored in the amber color bottle. और हार्ट में क्या कराता है सर? एरिथमिया. लीवर में क्या कराता है? हिपैटोटॉक्सिसिटी. बट लंग्स में क्या कराता है? ये ब्रोंकोडाइलेशन. दैट इज व्हाई दिस कैन बी यूज्ड इन अस्थमा पेशेंट. अस्थमा पेशेंट सर. Halothane, second best in the children. Now my question is, who is the first best gas in the children? And your answer is going to be the sevoflurane, sir. Before that, let's learn about the isoflurane, sir. Sir, this isoflurane is not used in the children. It is an agent of choice for cardiac and the neurosurgeries. Agent of choice for the cardiac and the neurosurgeries. Sir, desflurane, as dirty as 𝗏𝗏𝗺 Nala. So remember, this is a foul smelling, can cause a dyspnea. Best use for the neurosurgeries, but can be used in the others also. Others also. Okay? Then it is going to be the maximum greenhouse effect. And this is best for the maintenance of the anesthesia, sir. Desflurane is best for the maintenance. आपने anesthesia दे दिया, अब उसको maintain करने के लिए आप desflurane की थोड़ी थोड़ी गैस छोड़ते रहोगे, sir. Sevoflurane is a sweet smelling, best in children, given everywhere, just avoided in the renal patients, sir. Given everywhere, just avoided in the renal patient, my dear friends. Then coming to, okay, xenon. Okay, xenon. Xenon is like a ex-girlfriend or ex-boyfriend. Everything was better, but only problem was खर्चे, expensiveness नहीं झेली जा रही थी तो breakup हो गया. So xenon you should remember like this. Xenon is ideal anesthetic gas, lowest blood gas solubility, तेज भी थी, कोई greenhouse effect भी नहीं था. Still we cannot use it because it is very expensive. It is very expensive, very expensive, sir. Now coming to the nitrous oxide, my dear friend, nitrous oxide. It contain oxygen, so can cause fire. That is why this is contraindicated in laser surgeries. It can expand closed cavities. That is why it is contraindicated in pneumothorax, pneumoperitoneum, and intestinal obstruction like your intussusception. Pin index and MAC we are going to talk later on. MAC बहुत ज़्यादा है, इसलिए nitrous oxide is going to be less potent. If nitrous oxide is less potent, the nitrous oxide is not going to produce general anesthesia alone. So nitrous oxide is the first gas who required a more potent gas, for example halothane. So nitrous oxide is the first gas, nitrous oxide is requiring a second gas which is a halothane, and they both are going inside the body producing anesthesia, and then they both are coming out taking third gas, and that is oxygen. So first gas, second gas, third gas, and once oxygen is coming out, there is a third gas effect. And what is that? Diffusional hypoxia, which is also called as Fink effect. Diffusional hypoxia, which is also called as Fink effects. Okay, chalo. Now this is what I was explaining you, which is written right here. Nitrous oxide is having maximum max, so less potency. Hence it fails to cause general anesthesia alone. So it take help of a other anesthesial agent like halothane, which is a potent gas, to cause the second gas effect. When they both are coming outside, they are getting oxygen with them, and this will cause a diffusional hypoxia, which is known as third gas effect or Fink effect, my dear friend. Now in the day care surgery, if we talk about the gases part, desflurane, isoflurane, sevoflurane we can use, and day care surgery में IV agent के अंदर propofol is a raja, followed by midas and alfentanil, midas and alfentanil, sir. Now coming on to this table, this is based on this only. Here is contraindicated, rest we can use. ठीक है, चलो let's move on to the next one. IV anesthetic agent की बात करेंगे तो सबसे पहले we are going to talk about the thiopentone sodium. Sir, this thiopentone sodium is have a smell like garlic, लहसुन जैसी खुशबू. कैसी सर? लहसुन जैसी खुशबू, लहसुन जैसी खुशबू. एजेंट ऑफ अ चॉइस इन न्यूरोसर्जरी एंड लॉस ऑफ कॉन्शियसनेस. जब आप वेन से देते हो तो दिमाग तक जाने में ओनली टेक 11 seconds. It is contraindicated in porphyria, hypotension and heart block, sir. Sir, color is yellow, color amorphous powder is going. Thiopentone sodium, लहसुन जैसी खुशबू और न्यूरोसर्जरीज के लिए यूज होती है. प्रोपोफॉल, सर प्रोपोफॉल. प्रोपोफॉल इज व्हाट सर? योर गाबा रिसेप्टर एंड गाबा रिसेप्टर पे काम करती है. ठीक है, प्रोपोफॉल गाबा रिसेप्टर पे काम करती है. तो गाबा क्या कहता है? इनहिबिटरी न्यूरोट्रांसमीटर है सर. ठीक है. कलर, कलर इज मिल्की वाइट, कलर इज मिल्की वाइट. ठीक है. Composition, composition diisopropyl alcohol plus EGS. EGS stands for egg lecithin, glycerin and soybean oil. Soybean oil. This is a composition of a propofol, sir. Propofol, sir. Propofol, sir. Agent of choice. Agent of choice is agent of choice for day care surgery. Prolonged infusion can cause urine green color का और दर्द होता है जहाँ पे डालते हैं. प्लस टीवा एग्जाम क्वेश्चन, टोटल इंट्रावेनस, दैट इज इंडक्शन एंड मेंटेनेंस, बोथ कैन बी डन विद द हेल्प ऑफ टीवा, बोथ कैन बी डन विद द हेल्प ऑफ टीवा. ठीक है. कीटामाइन, मैकेनिज्म ऑफ एक्शन इज NMDA एंड NMDA एक्साइटेशन वाले के रिसेप्टर है. NMDA को एंटागोनिस्ट कर दिया तो मतलब क्या है? ब्लॉकेज होगा. ठीक है, दिमाग सोएगा. दिस इज हैविंग अ वेरी स्पेशल effect called as dissociative anesthesia effect. Which effect is very special right here is dissociative anesthesia effect. Sir, eyes are wide open but no memory, no pain. This is called as dissociative anesthesia. Dissociative anesthesia. Dissociative anesthesia. It is contraindicated in neurosurgery. Contraindicated in neurosurgery, sir. Then used in shock and asthma. It is used in shock and asthma. Shock and side effect is post-op hallucination. कीटामाइन का इंजेक्शन लगाओ तो जैसे मरीज उठता है उसको क्या है? हेलुसिनेशन होने लग जाती है, कुछ कुछ दिखने लग जाता है, सुनाई देने लग जाता है. Next is 𝗲𝗵𝗵𝗴𝗏, only CSF stable, avoided because it causes adrenal suppression. ठीक है, एड्रीनल सप्रेशन कराता है, लाइक फ्रीडशन सिंड्रोम की अंदर होता है. ठीक है, चलो, कमिंग टू द न्यूरोमस्कुलर ब्लॉकर्स इन द एनेस्थीसिया, इंपॉर्टेंट टॉपिक फॉर द एग्जाम सर. Sir, neuromuscular blockers, what they are doing, sir? Depolarizing and non-depolarizing. Sir, depolarizing, what is it? Depolarizing, what we are having? Succinylcholine and 𝗧𝗲𝗹𝗶. And non-depolarizing, we have 𝗵𝗚𝗎𝗏. So, depolarizing के अंदर what is happening? There is a contraction, there is a no contraction, then relaxation. So, because there is a contraction in the depolarization, yes, there is a pain present. And one phenomena is there, muscle of 4 phenomena, train of 4 phenomena which record the muscle relaxation pattern. So वो यहाँ record नहीं होता है क्योंकि relax होने से पहले वो contract कर रहा था. Now non-depolarizing, which only relaxes, they do not contract. Here the pain is absent. Plus along with the pain is absent, there is going to be along with the pain is absent, there is going to be the train of 4 response which is present. So here you have to remember, pain is present in depolarizing, D for दर्द, D for depolarizing, and non-depolarizing में नहीं होता दर्द. And train of 4, जहाँ दर्द नहीं होता वहाँ train of 4 present होता, जहाँ दर्द होता वहाँ train of 4 present नहीं होता, वहाँ present नहीं होता. Please join our Telegram channel for the PDF, my dear friends. Now non-depolarizing, long acting, intermediate acting, and fast acting. Long acting, intermediate acting, and fast acting. My dear friends, long acting, if we are to talk about, 𝗪𝗏 is better answer than pancuronium. Intermediate acting, 𝗵𝗚𝗎𝗏. This 𝗎𝗏 is very special previous year question. What is that? There is a Hoffman degradation. What do you mean by Hoffman degradation? Hoffman degradation is non-enzymatic breakdown. बिना enzyme के टूटता है. That is shown by a special property of a non-depolarizing muscle relaxant. Fast acting में we are having 𝗪𝗛 𝗪𝗛 𝗪𝗛. Local anesthetic, we are dividing it into amides and esters. Amide and esters. Amide and esters, my dear friends. If we talk about amide and esters, you will see amides के अंदर you will see there is a 1 eye, and ester के अंदर 1 eye, amide के अंदर you are seeing a 2 eyes. 2 eyes are there, sir. 2 eyes are there, sir. Now these all are metabolized by liver except cocaine. The cocaine is metabolized by pseudocholine esterase. This is again a question. This is how you will find a question, sir. Now, what is the management of systemic toxicity of a local agent? Another previous year question coming. This is symptomatic treatment. Whatever symptoms are there, treat them, plus 20% intralipid emulsion you have to give. 20% intralipid emulsion you have to give. 20% intralipid emulsion you have to give, sir. Then coming to the local anesthetic agent. Sir, intermediate acting and long acting you have to read right now with me, sir. Sir, intermediate acting is lidocaine. And long acting Debu is better answer than 𝗵𝗑𝗏. 𝗵𝗑𝗏 is the most cardiotoxic and they block the sodium channel. They block what, sir? Sodium channel. Chalo. Now, sir, malignant hyperthermia is the next important topic for the exam. Sir, due to mutation in the ryanodine receptors on the neuromuscular junction on chromosome number 19 and 17, there is an excess release of a calcium. There is an excess muscle contraction, because of which there is a increase in potassium, and because of increase in potassium there is going to be the arrhythmia. And if mostly muscles are contracting, the muscle will break down and it will come inside the urine. And remember, this is called myoglobinuria, and drug of choice to malignant hyperthermia is dantrolene sodium. Now triggering agent कौन है? साली, SALI. ये देखो निमोनिक है भाई. ट्रिगरिंग एजेंट कौन है? साली, SALI, साली. याद रखना, सक्सिनाइलकोलिन, all inhalational agent like halothane, isoflurane, CO, desflurane, these are triggering. Plus lignocaine is a triggering agent for the malignant hyperthermia. They are the triggering agent for the hypothermia. Done, sir? Now opioid only used for analgesic property. Best opioid is remifentanil. Now again, like locals, अपना क्या कहते हैं, local anesthetic agent were metabolized by liver except cocaine by pseudocholinesterase. Same here for the opioids. All opioids are metabolized by liver except remifentanil, which is the best opioid, which is metabolized by non-specific esterase. Non-specific esterase. तो दो ऐसे सवाल एग्जाम में याद रखिएगा. Now coming on to the ASC grading. ASA1 American Society of Anesthesiologists की grading आती है, तो याद रखना ASA1 says normal, ASA2 says mild systemic disease, 3 says mild systemic disease, sorry, severe systemic disease, 4 says severe systemic disease which is constant threat to life, answer 5 says moribund, and 6 says declared brain dead. Declared brain dead. moribund का मतलब है कि आप बिना सर्जरी के सर्वाइव नहीं कर सकते. Now let's move on to a very next topic, a very important topic for the class, and that is going to be the pin index. That is going to be the pin index, sir. Pin index. Pin index कैसे लिखना ऊपर 5, 6, 7, 5, 6, 7, 1, 5, 2, 5, 3, 5, 1, 6, 2, 6, 3, 6, and 7. This is how you will remember the important pin index. 1, 5 is for the air, 2, 5 is for the oxygen, and 3, 5 is for the nitrous oxide. 1, 5 air, 2, 5 oxygen, and 3, 5 nitrous oxide. Now carbon dioxide, 1, 6 is more than 7%, 2, 6 is less than 7%, and 3, 6 is cyclopropane. Antonox, entertainment day, mixture of two gases, oxygen and nitrous oxide, sir. Now color of the cylinder is also very important, and here you will tell me the pin index also. Air is having grey body with black and white shoulder. What is the pin index of the air? You will comment simultaneously in the chat box, my dear friends. All the brave hearts who are just sitting around the corner, round the clock to work hard to see them pass in the exam. My dear friends, next is oxygen cylinder. Yes, medico, very nice. Oxygen cylinder, we are having black body, white shoulder. We are having what, sir? Black body and white shoulder. This black body, white shoulder, we are having a pin index of 2.5. Then coming to the nitrous oxide. Nitrous oxide is having what, sir? Your blue color, and the pin index of nitrous oxide also you have to comment the 3.5. Then carbon dioxide, grey color. This gas is used in the laparoscopic surgeries. 1.6 and 2.6. 1.6 is more than 7%, 2.6 is less than 7%. So cyclopropane, 3.6 is a pin index and color is orange color. Antonox is a mixture of two gases. Pin index is 7. Remember, blue body with the white shoulder. Blue body with the white shoulder. Chalo, let's move on to the next part. Intubation. Next part is intubation. Sir, intubation के लिए कौन सी position जरूरत है? Sniffing. What is happening in this sniffing position? These two lines are MCQ. Chin is lifted and head is tilted. Chin उठी हुई है, head झुका हुआ है. And remember, if there is an injury to the cervical spine, then you will not use this position. Then what you will do? Jaw thrust position, where the mandible is protruded out, and then you will intubate the patient. Sir. Coming on downward, 𝗲𝗵𝗵𝗿 scoring. This 𝗲𝗵𝗵𝗿 scoring is very, very important to predict the intubation. If you are able to see all the structures, class 1 and class 2, up to the base of the uvula, if you are seeing, that means soft and hard palate you are seeing, plus base of the uvula, yes, you can intubate. If you are not able to see complete uvula, then no, only hard palate, no. Then, so this is 𝗲𝗵𝗵𝗿 scoring. Then laryngoscope, after maintaining the intubation position, after seeing whether you can intubate or not, you have to know the type of laryngoscope you are using, and with the non-dominating hand you do, so that with the dominating hand you can put tube inside. ऐसे पकड़ के ट्यूब डाल सको. The मक्खन-तोश is most commonly used in the adult, और बच्चों के अंदर मिलर यूज होता है. मिलर is सीधा, और बच्चों एडल्ट का कैसा होता है? टेढ़ा, like this. ठीक है, like this. मिलर कैसा होता है? सीधा, और बच्चों का कैसा होता है? टेढ़ा. सर, डन. चल, endotracheal tube, curved endotracheal tube. सबसे पहले important question for the exam. It is the best. Why it is best, my dear friends? हम इसका गाना क्यों करें? Because it prevents the aspiration. It prevents what, sir? It prevents the aspiration. And what special thing this is having? Inflated cup. Plus, why this extra opening is there? एक छेद तो सर दूसरे की क्या ज़रूरत पड़ी। दोस्तों अगर ये बंद हो जाए तो इसको सहारा देने के लिए एक दूसरी ओपनिंग बनाई जाती है, तो एग्जामिनर ने भी इसका जिक्र करा था एग्जाम में। दिस इज कॉल्ड एज मर्फीज आई। देन कमिंग टू द डबल ल्यूमन एंडोट्रैकियल ट्यूब सर, this is 2020 exam December question. Double lumen endotracheal tube is used for the lung surgeries because this can provide the single lung ventilation. सिंगल एक लंग में आप सर्जरी कर रहे हो, दूसरे में आप जो है ऑक्सीजन दे सकते हो। दिस इज अ स्पेशल फीचर अबाउट दिस। फ्लेक्सियोमेटालिक ट्यूब व्हाट वी यूज इन द हेड एंड नेक सर्जरीज। फ्लेक्सियोमेटालिक ट्यूब क्यों यूज करते हैं? क्योंकि हेड एंड नेक सर्जरी में आपको सर्वर हिलाना पड़ता है, ठीक है, या प्रोन पोजीशन सर्जरीज हो उसके अंदर यू हैव टू यूज दिस फ्लेक्सियोमेटालिक। द ईएनटी सर्जन आल्सो मोस्टली यूज द फ्लेक्सियोमेटालिक ट्यूब। सर सुप्राग्लॉटिक एयरवे डिवाइसेस लाइक LMA क्लासिक, प्रोसील। क्लासिक थोड़ा बेकार सा डिवाइस है, कैन नॉट प्रिवेंट एस्पिरेशन। ओके, नाउ प्रोसील इज हैविंग अ स्मॉल ओपनिंग where the drain is present and it can prevent the aspiration. LMA Supreme is the best because of the shape, easy to put, and also one more additional feature in there is you can put a gastric tube which will help in a gastric lavage also, sir. Then coming to the iGel, self inflation property होती है इसकी, अंदर डालोगे जितना साइज रिक्वायर्ड होगा उतना ये इन्फ्लेट हो जाता है अपने आप। दिस इज iGel, sir. Now this is what happening. This is happening in neuromuscular monitoring, sir. And here the nerve test is ulnar test, ulnar nerves. Defibrillator, automatic, mechanical, non-breathable mask. You can see. Then Guddle's airway and nasopharyngeal airway. Guddle's airway is a oropharyngeal airway, sir. Open the mouth in an unconscious patient. Unconscious patient के अंदर मुंह खोलने में काम आता है, ठीक है, कहाँ सारे मुंह नहीं खुल रहा, ठीक है, ओके, डन। Then size mid point of incisor to the angle of mandible, यहाँ से यहाँ तक इसका साइज नापा जाता है, ठीक है। Nasopharyngeal airway indication is conscious patient because if you will do the nasopharyngeal airway, put the tube in the unconscious patient from the nose, there are chances that you might can injure the nose and you will not come to know. And from the nose, from the posterior side, from the posterior wall, it will go to your lungs and person can aspirate and person can die, and his size is taken from nose till the ear lobule. Next is Venturi mask. We can put the vaporizer, also we can control the flow. Ambu bag is for the mechanical ventilation. Now what is this mechanical ventilation? Sir, here you will connect a oxygen and here you have to put on the mouth of a patient. 1 2 3 4. If your ventilator is not available, this is mechanical ventilation you have to give to your patient, my dear friends. Now coming to the tracheostomy tube, we are talking about, this is tracheostomy tube. We have talked about the indications of tracheostomy tube. Prolonged intubation more than 7 days. Prolonged intubation, any kind of facial trauma, maxillofacial trauma, उसके अंदर हमें tracheostomy tube डालना सर। Any kind of supraglottic cancer which is obstructing the airway, we can put the tracheostomy tube. Sir. ठीक है? Portex tracheostomy tube is the most common, sir. Now, how to approach the difficult airway? सबसे पहले mask ventilation, उसके बाद intubate कर दो हो जाता है, तो फिर अगर intubation में भी दिक्कत आ रही तो laryngeal mask airway, अगर इसके बाद भी नहीं हो रहा तो cannot intubate, cannot ventilate. This is CICV. In this condition you will go for 𝗲𝗵𝗵𝗿𝗺. So remember, पहले मास्क ऊपर से फिर इंटूबेट करने की कोशिश करी, उससे भी नहीं हो रहा तो कम से कम लेरेंजियल एयरवे डाल दिया, LMA प्रोसील ये सब डाल दिया। अगर इससे भी नहीं हो पा रहा, then in the last step you will do a 𝗲𝗵𝗵𝗴𝗿𝗺. Now Boyle's machine. This is example of a cold close apparatus. Sir, this is example of cold close apparatus. Here you will see what is happening. Your carbon dioxide is getting absorbed inside only, and the absorbent is soda lime. Absorbent is what, sir? Your soda lime. Plus you have a vaporizer also. Plus you can humidify, control the flow. You can give the oxygen also. That is why close machines are very important. Boyle's apparatus, what we use in the daily life. Now anesthetic agents which we put in this vaporizer are having different colors. So what different colors we are having, my dear friends? First is halothane. हेलोथेन इज रुको, रुकने का कलर कौन सा होता है बेटा? रेड कलर। कौन सा होता है दोस्तों? रेड कलर इज देयर सर। सीवोफ्लोरेन येलो कलर की सिवैयां, येलो कलर। डेसफ्लोरेन डर्टी नाला, नाक बंद हो गया, ब्लू कलर सर। एनफ्लोरेन ऑरेंज कलर। आइसोफ्लोरेन पर्पल कलर। आइसोफ्लोरेन पर्पल कलर इज देयर। आइसोफ्लोरेन के लिए पर्पल कलर इज गोइंग टू बी देयर सर। नाउ कैपनोग्राफी, इट इज मेजरिंग द एयर फ्लो। एयर फ्लो को मेजर कर रही है कैपनोग्राफी। इंस्पिरेशन, एक्सपिरेशन, अपस्ट्रोक, then plateau phase will come, then it will go out. Now it is measured with the help of capnography. So normally the range should be between your 35 to 45 mmHg. If the person is hyperventilated, then the person peak will be less than 35. He will be doing less than 35. It will be hyperventilated. Peak will be showing like this. If the person is hypoventilated, he cannot wake up and tell you I am hypoventilated. He will take breath like this. So bigger peaks will come which will exceed the 45 level. 45 level like this you can see. If shark fin pattern is coming, this is typically seen in the COPD. Now when the anesthesia machine is there, sir, what do you need to monitor? Sir, ECG, BP, pulse oxy, capno and temperature. Capno and temperature. BIS monitoring is to check the depth of the anesthesia. BIS monitoring is done to check the depth of the anesthesia. 0 is there, that means coma. 100 is there, matlab fully awake, and 40 to 60, that is you have to maintain during the surgery. Now open circuits में आपके पास open circuit में easy but not use. Why? Because in the same room you are getting the carbon dioxide. If in the same room you are getting the carbon dioxide, there is chances you will get the hypercapnia and you will lose the control. Closed circuit, we have just take example of a Boyle's machine. Now semi-closed circle, which is Mapleson circuits A, B, C, D, E, F, in which E and F are for the pediatrics age group. In this, 𝗖𝗵𝗵𝗿 and Jackson-Rees is there. This 𝗖𝗵𝗵𝗿 is for the premature baby and Jackson-Rees is for the babies less than 6 years. Babies less than 6 years, sir. Okay? Chalo. Now Magil circuit, Magil circuit is for the spontaneous ventilation. Maggie खाने का मन ऐसे करता है spontaneously. So Magil is, and Bain circle is for the controlled ventilation. Rest BC is not used. BC is not used. Fluid for the surgery. Colloid is a blood product like PRBC, platelet, fresh frozen plasma. Crystalloids are divided into two: isotonic and hypertonic. Isotonic and hypertonic. My dear friends, yes, isotonic is like a normal saline and Ringer lactate. Sir, normal saline and Ringer lactate, if you see, Ringer lactate is a fluid of choice in surgery, plus it is a fluid of choice in burn patient, fluid of choice in severe dehydration also, sir. Severe dehydration also, sir. Now hypotonic, which do not increase the volume, they do not increase the volume. The example is dextrose 5%, 10%, 25%. Why they are given? They are given specifically when there is a low glycemic index, very low sugar, even 30, 20, 10 sugar होती है, एकदम से हम dextrose 5-10% देते हैं. It improves, patient is saved. Now American Heart Association chain of survival, कि अगर कोई आदमी को हार्ट अटैक हॉस्पिटल में आता है तो क्या स्टेप फॉलो करने हैं, आउटसाइड द हॉस्पिटल आता है तो क्या स्टेप फॉलो करने हैं. This question has been asked in the exam, my dear friends. Yes. So first of all, we are talking about the chain of survival in the hospital if cardiac arrest is happening. My dear friends, in the hospital, if it is happening, the first thing is early recognition and prevention, activation of emergency response, high quality CPR, defibrillator, post cardiac arrest care and recovery. Sir, out of hospital if it is happening, first of all, activation of emergency response. This is what I need to tell you. सबसे पहले emergency response, high quality CPR, defibrillator, advanced resuscitation, post cardiac care and recovery. This chain of survival is slightly different in hospital. अगर आपको कुछ भी नहीं पता चल रहा तो याद रखना, अगर एम्बुलेंस का फोटो दिया है तो ये आउटसाइड है, नहीं दिया है तो ये इनसाइड है. पहला अगर फोन मिलाया जा रहा है तो आउटसाइड है, पहले अगर रिकॉग्नाइज किया जा रहा है दिस इज इनसाइड. ACLS का छोटा सा चार्ट है, मॉनिटर करो. ECG शॉक रिदम में, अगर रिदमेबल शॉक है तो CPR का साइकिल स्टार्ट कर दो. मीनवाइल एडीआर एमिड्रॉन दे दो। एडीआर कितना देना होता है, 3 से 5 मिनट में 1 ml देना होता है। मीनवाइल आपको एमिड्रॉन देना है, एंटी एरिथमिक ड्रग है जो पहले 300 mg देना है, फिर 150 mg देना है। इफ इट इज नॉट अवेलेबल लिग्नोकेन देना है। इफ नॉन शॉकेबल रिदम दे है वी कंसिडर दैट एज एसिस्टोली।